Top 12 Warning Signs of Blood Clots. Imagine your body harboring a silent threat, lurking in the shadows, waiting for the right moment to strike. A ticking time bomb that could turn your world upside down in the blink of an eye. Blood clots, these tiny clumps that form in your veins, might seem insignificant, but they carry disastrous consequences. They can travel through your bloodstream, leading to heart attacks, strokes, and even sudden death. Yes, the risk is real, and the danger is closer than you think. But how can you tell if your body is sending out warning signals? What if you could recognize these subtle signs before it's too late? In today's video, we're diving deep into the top 12 warning signs of blood clots that you simply cannot afford to ignore. Stay with us, because understanding these signs could be the difference between life and death. Ready to uncover the truth? Let's dive in. 1. Swelling. Might seem like just an annoying puffiness, like when you've had one too many salty snacks, but it can actually be a serious red flag. Now, we're not talking about that post-popcorn movie night bloating. This is a different kind of swelling. When your body starts to resemble a balloon, especially in your legs or arms, it could be a sign that a blood clot is playing hide and seek in your veins. Here's how it works. A blood clot can block the normal flow of blood, leading to a backup that causes the surrounding area to swell. Think of it like a traffic jam in your bloodstream, where the cars, or blood cells, can't move past the roadblock, causing a pileup. This swelling isn't just about looking a little puffier than usual, it's your body waving a giant red flag, saying, "Hey, something's seriously wrong here." Now, the tricky part is that swelling from a blood clot can sneak up on you. It might start off subtle, like your leg feeling a bit tighter in your jeans, but it can quickly escalate. And here's where it gets serious. If the clot decides to break free and travel to your lungs, it could cause a pulmonary embolism, a potentially fatal condition. So, this isn't the kind of swelling you want to ignore or brush off as just one of those days. According to the Mayo Clinic, deep vein thrombosis, DVT, which is just a fancy term for a blood clot deep in the veins, usually in the legs, is a major cause of this type of swelling. Studies have shown that DVT affects hundreds of thousands of people every year, and if left untreated, it can lead to life-threatening complications. But let's not get too grim. After all, we promise to keep things lively. Think of swelling like a really bad roommate. At first, they're just a little annoying, leaving dishes in the sink or making your leg a bit puffy. But before you know it, they're hosting wild parties every night, or causing major discomfort and pain, and suddenly, you're facing eviction, or, in this case, a health crisis. The moral of the story? Don't ignore the bad roommate, or the swelling. Pay attention, seek help, and kick that bad roommate out before things get out of hand. So, the next time you notice unusual swelling, remember, it's not just a cosmetic issue. Your body might be trying to tell you something critical. 2. Pain or tenderness. Might sound like something you'd expect after a long workout or a clumsy bump into a piece of furniture. But when it comes out of nowhere, with no clear reason behind it, it might be more than just your muscles complaining. It could be a sneaky sign that a blood clot is up to no good in your body. Here's the lowdown. Pain or tenderness related to blood clots often occurs in the legs, particularly in the calf or thigh. This isn't your usual "I did too many squats at the gym" kind of pain. Instead, it's more like your leg is sending you a text message, saying, "Hey, something's wrong here, pay attention." The pain might start as a dull ache or tenderness that gets worse when you stand up or walk, and it can be easy to brush off. After all, life gives us plenty of reasons for random aches and pains. But here's the kicker: when this pain is linked to a blood clot, it's due to the clot blocking blood flow in the vein. Imagine a river suddenly encountering a dam. Everything backs up, and the pressure builds, causing the pain. This type of pain is your body's way of letting you know that there's a blockage somewhere in the system, and it's not happy about it. Now, the real danger comes when the clot decides it's had enough of sitting in one spot and takes a road trip to your lungs. That's when things can get really serious, really fast. According to the National Heart, Lung, and Blood Institute, pain or tenderness is one of the primary symptoms of deep vein thrombosis, DVT, and it should never be ignored. In fact, Studies have shown that ignoring this type of pain can lead to severe complications, including pulmonary embolism, which is potentially fatal. So, what should you do if you start feeling this unexpected pain or tenderness? Don't ignore it. Get it checked out, because when it comes to blood clots, it's better to be safe than sorry. 3. Redness or discoloration. On your skin might seem harmless at first, like a mild sunburn, an allergy flare-up, or maybe even a brush with a particularly clingy pair of socks. But when it shows up unexpectedly and lingers, it could be more than just a minor irritation. This is your body's way of waving a red flag, literally, and telling you that something more sinister might be going on beneath the surface. When we talk about redness or discoloration as a sign of a blood clot, we're not talking about the kind of redness you get after a brisk walk or a hot shower. This is a distinct, often localized patch of redness, typically on the leg, that doesn't seem to have a logical cause. It's like your skin has decided to throw a spotlight on one area, and that spotlight could be shining on a blood clot. So, why does this happen? When a blood clot forms in a vein, particularly in a deep vein, QDVT, or deep vein thrombosis, it can cause inflammation in the surrounding tissue. This inflammation leads to redness, as the blood flow is disrupted and the area becomes irritated. It's like your body is saying, "Hey, something's not right here, pay attention." According to the American Heart Association, this redness is often one of the first visible signs of a clot. Studies have shown that this discoloration can range from a slight pinkish hue to a deep red or even a bluish tint, depending on the severity and location of the clot. The key thing to remember is that this isn't just a surface-level issue, it's a sign that there's trouble brewing deeper down. Imagine your skin as a drama queen, always trying to grab your attention. Most days, it's pretty quiet, maybe a little dry or oily, but nothing major. Then one day, out of the blue, it decides to put on a full-blown performance, bright red spotlight, dramatic flare, the works. You might think, "Oh, what's got you so worked up today?" But in reality, this isn't just your skin being extra, it's actually trying to tell you that something serious could be happening underneath. So, the next time your skin starts acting out with some unexpected color, think of it as your body's way of sending a smoke signal. It's a sign that you need to dig a little deeper, literally. 4. Warmth. Warmth, normally, it's something we seek out, whether it's the cozy comfort of a blanket on a chilly evening or the inviting embrace of the sun on a summer day. But when warmth pops up in one specific area of your body, without a clear reason, it could be more than just a friendly reminder to kick back and relax. In fact, this unexpected warmth might be your body's way of signaling that a blood clot is taking up residence in your veins. Here's the science behind it. When a blood clot forms, it can cause the surrounding area to become inflamed. This inflammation often leads to an increase in temperature at the site of the clot, making the skin feel unusually warm to the touch. It's as if your body has turned up the thermostat in that one spot, trying to draw your attention to the underlying issue. According to the Cleveland Clinic, this localized warmth is one of the telltale signs of deep vein thrombosis, DVT, particularly when it occurs in the legs. Now, let's think of this warmth as your body's version of a hot spot, but not the kind you want to brag about. Imagine your legs suddenly feeling like it's hosting a mini heat wave, but the rest of your body is just fine. It's as if your veins decided to throw a party, and they cranked up the heat, hoping you'd notice. And notice you should, because this warmth isn't just a random temperature spike, it's a sign that something's disrupting the normal flow of blood, and that something could be a blood clot. So, next time you feel an unexpected wave of warmth in one specific area of your body, don't just brush it off as your inner thermostat being a little quirky. Think of it as a signal flare, a warning from your body that it's time to pay attention. 5. Cramping. Now there's a word that can make anyone wince. Whether it's a muscle spasm during a workout or that dreaded Charlie horse that strikes in the middle of the night, cramps are rarely welcome. But what if I told you that cramping could be more than just an inconvenient muscle twitch? In some cases, it could be a sign that a blood clot is lurking in your body, waiting to cause trouble. Let's dive into the science first. Cramping associated with blood clots often happens in the legs, particularly in the calf. Unlike the typical muscle cramp that hits after a strenuous workout or from dehydration, this type of cramping tends to be persistent and can't be easily relieved by stretching or massaging the area. Now, here's where it gets tricky. Cramps are common, and most of the time, they're harmless. But when the cramp is persistent, unusually painful, or occurs alongside other symptoms like swelling, warmth, or redness, it's time to pay closer attention. According to the National Institutes of Health, cramping is one of the key symptoms of deep vein thrombosis, DVT. Research shows that people often mistake this cramping for a muscle injury or strain, which can delay proper diagnosis and treatment. And that's a delay you don't want, because untreated blood clots can lead to serious complications, like a pulmonary embolism. The point here is that cramping, especially when it's persistent and doesn't respond to typical remedies, is your body's way of signaling that something's wrong. It's like that employee who's been quietly grumbling for weeks, but now is ready to stage a full-on protest. The key is to listen to your body before things escalate. 6. Shortness of breath. It's that unsettling feeling when you can't seem to catch your breath, even when you're just sitting still. Now, we all know that huffing and puffing after sprinting up a flight of stairs is pretty normal, but when shortness of breath strikes out of nowhere, it's like your body is hitting the panic button, and that's when you need to pay attention. This seemingly simple symptom can be a serious sign that a blood clot is causing chaos inside your body. Let's break it down. Shortness of breath becomes particularly concerning when it's linked to a blood clot that has traveled from your legs to your lungs, a condition known as a pulmonary embolism, PE. When a clot lodges in one of the arteries in your lungs, it blocks blood flow and reduces the amount of oxygen that gets into your bloodstream. The result? Your lungs and heart are forced to work overtime, making you feel like you've just run a marathon, even if you've only walked across the room. According to the American Lung Association, shortness of breath is one of the hallmark symptoms of a pulmonary embolism, and it can appear suddenly, often without warning. Research shows that PE can be life-threatening, especially if it's not caught early, which is why understanding this symptom is so critical. Imagine your body as a finely tuned orchestra. Normally, everything plays in perfect harmony, your lungs, heart, and blood vessels all working together like a well-rehearsed symphony. But then, a blood clot shows up like a rogue tuba player, blaring out of tune and throwing the whole performance off. Suddenly, you're gasping for air, like the conductor waving his arms frantically, trying to regain control. That shortness of breath is your body's way of saying, something's gone wrong in the orchestra pit, and we need to fix it now. So, how do you know if your breathlessness is just a random hiccup or something more serious? If you're feeling short of breath, especially if it's paired with other symptoms like chest pain, dizziness, or a rapid heartbeat, it's time to take it seriously. According to the Mayo Clinic, shortness of breath due to a pulmonary embolism can come on suddenly and may worsen with activity, so don't brush it off as just being out of shape. 7. Chest pain is one of those symptoms that instantly makes people sit up and take notice, and for good reason. While it can sometimes be chalked up to something as benign as heartburn or a muscle strain, when it comes out of nowhere and hits with a certain intensity, chest pain can be a flashing red warning sign that something much more dangerous is going on inside your body. Let's dig into the details. When a blood clot travels to the lungs and lodges in one of the pulmonary arteries, it can restrict blood flow and put immense pressure on the heart. This situation can cause chest pain that feels sharp, stabbing, or even like a heavy weight pressing down on your chest. The pain might worsen when you take a deep breath, cough, or even when you lie down. It's your body's way of saying, hey, something's blocking the pipes here, and it's not good. Scientific studies have shown that chest pain is a common symptom of pulmonary embolism, which can be a life-threatening condition if not treated promptly. According to research published in the New England Journal of Medicine, chest pain associated with PE is often misdiagnosed, sometimes mistaken for a heart attack, which only underscores the importance of understanding this symptom in the context of blood clots. But here's where it gets tricky. Chest pain can be caused by a variety of factors, and not all of them are life-threatening. However, when chest pain is paired with other symptoms like shortness of breath, dizziness, or a rapid heartbeat, the chances increase that it's something serious, like a pulmonary embolism. 8. Rapid heartbeat. A rapid heartbeat, it's the kind of thing that can get your attention in a hurry. Sure, your heart might race when you're watching a suspenseful movie, or when you've had one too many cups of coffee. But when your heart suddenly starts pounding like a jackhammer without any obvious reason, it's not just trying to keep up with the latest plot twist or caffeine rush. It might be a sign that a blood clot is stirring up trouble in your body, and it's sounding the alarm. So, what's really going on when your heart kicks into overdrive? When a blood clot forms, especially one that leads to a pulmonary embolism, PE, your body senses that something is seriously wrong. In response, your heart starts working overtime, trying to pump blood past the blockage and keep oxygen flowing to your vital organs. This frantic effort can make your heart race, what's known in medical terms as tachycardia. According to the American Heart Association, a rapid heartbeat is one of the key symptoms of a pulmonary embolism. Studies show that when a clot blocks blood flow in the lungs, the heart compensates by increasing its rate, sometimes pushing up to 100 beats per minute or more. This isn't your heart just being dramatic, it's a physiological response to a life-threatening situation. This sudden acceleration in your heart rate can be frightening, especially if it comes with other symptoms like chest pain, shortness of breath, or dizziness. But here's the thing, a rapid heartbeat on its own isn't always a cause for panic. It can be triggered by a variety of factors: stress, anxiety, or even dehydration. However, when it happens unexpectedly and is accompanied by other signs of a blood clot, it's your body's way of waving a red flag. It's like your heart is trying to shout over the noise, "Pay attention, we've got a problem here." 9. Coughing up blood. Now there's a symptom that's hard to ignore. It's the kind of thing that can turn a casual cough into a moment of pure panic. While it's not something anyone wants to experience, this alarming sign can be your body's way of signaling a serious issue, such as a blood clot in your lungs, also known as a pulmonary embolism, PE. So, what's happening when you cough up blood? In the context of a pulmonary embolism, a blood clot that has traveled to your lungs can cause tissue damage and inflammation. This disruption can lead to a rupture in the small blood vessels within the lungs, resulting in blood being coughed up. It's not just a little red speck here and there, this can be a significant amount of blood, and it's your body's way of saying, "Hey, we've got a serious problem on our hands." According to the American Thoracic Society, hemoptysis, the medical term for coughing up blood, is a less common but very serious symptom of a pulmonary embolism. Studies show that when this symptom occurs, it indicates that the embolism is causing considerable damage to the lung tissue, which requires immediate medical attention. According to the Mayo Clinic, coughing up blood in the context of a pulmonary embolism is a medical emergency. The longer you wait, the more damage the clot can cause, leading to further complications like respiratory failure. But here's where it gets tricky: coughing up blood can be caused by other conditions as well, such as infections, chronic lung diseases, or even something as simple as a nosebleed that trickles down your throat. However, when it happens suddenly and without an obvious cause, especially if accompanied by other symptoms like chest pain or shortness of breath, it's a sign that you need to seek medical help immediately. 10. Dizziness or lightheadedness. These are sensations that most of us have experienced at one time or another. Maybe you stood up too quickly, or perhaps you were feeling a bit under the weather. But when these symptoms hit you out of the blue, especially when paired with other warning signs, they might be more than just a fleeting moment of imbalance. Let's get into the details. When a blood clot forms, especially in a large vein or in the lungs as a pulmonary embolism, PE, it can obstruct blood flow and lead to a sudden drop in blood pressure. This drop in blood pressure is what often causes the sensation of dizziness or lightheadedness. Essentially, your brain isn't getting enough oxygen-rich blood, and it reacts by making you feel woozy, almost like you're about to pass out. According to the Centers for Disease Control and Prevention, CDC, dizziness or lightheadedness is a symptom that can be associated with a pulmonary embolism or even deep vein thrombosis, DVT, if the clot is large enough to impact circulation significantly. Studies show that when blood flow is compromised, your body goes into preservation mode, prioritizing essential functions and sometimes leaving you feeling like you're on the verge of fainting. But here's the tricky part: dizziness or lightheadedness can be caused by a myriad of factors, from dehydration to anxiety to low blood sugar. However, when it comes out of nowhere, especially if it's severe or accompanied by symptoms like chest pain, shortness of breath, or a rapid heartbeat, it's not something to shrug off. According to a study published in the Journal of Thrombosis and Hemostasis, dizziness in the context of a blood clot is often linked to a significant drop in blood pressure, which can be life-threatening if not addressed promptly. 11. Severe headache. It's the kind of pain that can stop you in your tracks, making you want to crawl into bed and hide from the world. While headaches are incredibly common and often harmless, when they come on suddenly and with intensity, they can be more than just a nagging inconvenience. In some cases, a severe headache could be a warning sign of a blood clot, particularly one in the brain, known as cerebral venous sinus thrombosis, CVST. Let's dive into the science. When a blood clot forms in one of the brain's venous sinuses, it can block the blood flow that's supposed to drain from your brain. This blockage increases pressure within the skull, leading to a severe headache. This isn't just your average tension headache from a stressful day at work, it's a headache that feels like a freight train has decided to set up shop in your brain. The pain can be excruciating, and it often doesn't respond well to typical over-the-counter pain relievers. According to research published in the New England Journal of Medicine, cerebral venous sinus thrombosis, while rare, is a serious condition that can lead to stroke, brain swelling, or even death if not treated promptly. The severe headache associated with CVST is often one of the first and most noticeable symptoms, making it crucial to recognize and respond to this warning sign. But let's keep things in perspective. While a headache can be caused by many factors, not all of them are life-threatening. However, it's the severity, sudden onset, and accompanying symptoms that should raise the alarm. So, what should you do if you find yourself with a sudden, severe headache? Don't just reach for the aspirin and hope it goes away. Instead, think of it as your brain sending out an SOS signal, and it's up to you to respond. Seek medical attention, especially if the headache is out of the ordinary or if you notice other symptoms that could indicate a blood clot. 12. Sudden loss of vision. It's the kind of symptom that can turn your world upside down in an instant. Imagine going about your day, everything normal, and then, without warning, your vision dims or disappears altogether. It's a terrifying experience, and while it might seem like something out of a horror movie, it can actually be a sign that a blood clot is causing serious trouble in your body. Let's get into the science. When a blood clot forms and travels to the arteries that supply your eyes, it can block blood flow, leading to a sudden loss of vision. This can occur in one or both eyes, depending on where the clot is lodged. The condition is often referred to as retinal vein occlusion or, more specifically, central retinal artery occlusion, CRAO, if the main artery supplying the retina is blocked. The retina is responsible for converting light into the images we see, so when its blood supply is cut off, it can lead to immediate and profound vision loss. According to the American Academy of Ophthalmology, CRAO is considered an ocular emergency. Studies show that if blood flow isn't restored quickly, the damage to the retina can become permanent, leading to irreversible blindness. Time is of the essence, and prompt medical intervention is crucial to saving your sight. Now, let's add a twist of humor to keep things engaging. Imagine your eyes as the windows to your soul, nice, clear, and letting all the light in. But then, a blood clot shows up like an unwanted guest, throwing mud on those windows and blocking your view. Suddenly, everything goes dark, and you're left wondering, who turned off the lights? But here's the kicker, this isn't just someone playing a prank, it's your body telling you that something is seriously wrong. So, what should you do if you suddenly lose your vision? Don't wait and hope it clears up. It's like your body pulling the emergency brake, something's blocking the path, and you need to clear it out before the damage becomes permanent. Seek immediate medical help, because when it comes to vision, time lost can mean vision lost. In summary, sudden loss of vision is a critical warning sign that a blood clot may be obstructing blood flow to your eyes. It's not just a temporary inconvenience, it's a medical emergency that requires prompt attention to prevent permanent damage. As we close out this look at the top 12 warning signs of blood clots, remember, your body is constantly sending you signals. From swelling and cramping to sudden vision loss and dizziness, these aren't just random symptoms, they're your body's way of saying, something's not right. Spotting these signs early could be the key to preventing serious health issues. Here's the bottom line: knowing these signs can protect you and those you care about. If anything in this video struck a chord, don't keep it to yourself, share it with others. You never know who might need this information. Before you go, let's stay connected. If you found this video helpful, give it a thumbs up, drop a comment, and share your thoughts or experiences. And don't forget to subscribe and hit the bell so you're always in the know. Remember, an ounce of prevention is worth a pound of cure. Stay alert, listen to your body, and take action when something feels off. Thanks for watching. Here's to a healthier, more informed you.